Ms. Mariam Jaafar.
Chairman, our healthcare workforce needs to transform to accelerate the implementation of the 3 Beyond strategy. First, putting in place the organizational enablers to support the shifts in the 3 Beyonds, how to manage the workforce across the public and private healthcare system in the new healthcare delivery model and increase their productivity. Doctors, GPs, nurses, pharmacists, and more in the community will play new roles and need to be empowered with new skills, capabilities, evidence-based practices, and tools as we move beyond hospital to community. As we move beyond quality to value, behavioral shifts are needed across the system, from the hospital CEO to frontliners. As we shift beyond healthcare to health, new skills will be needed in areas such as data analytics and behavioral economics. Across the board, new ways of working, much more multidisciplinary, much more agile will be needed. This means putting in place the right org structures, clarity of roles and responsibilities, aligning funding models, KPIs, and incentives, and bringing in and building the right talent. Can the minister share what the government is doing to facilitate this transformation? Second, the work of the healthcare worker needs to be digitally reimagined as we move to increasingly digital integrated care. New digital roles will be needed in data analytics and AI, in robotics, and they will need to be brought in from outside. But importantly, all healthcare workers will need to embrace digital skills and adopt a digital mindset, seeing digital as an enabler rather than a threat. What form of digital reskilling and upskilling programs are being developed to help our healthcare professionals pivot to the digital future of healthcare? Third, addressing the shortage of nurses. Nurses are the bedrock of our healthcare workforce. At around 7.5 nurses to 1,000 population, our nurse-to-population ratio is lower than the OECD average of 9. The burden of the pandemic has, without a doubt, been felt most keenly by our tired nurses. With an aging population, increasing life expectancy, and increasing incidence of chronic diseases, the demand for nurses can only continue, and in the intensity and nursing care required will also increase. As we shift beyond hospital care to community care, nurses will be needed not only in hospitals, but also in the community. I think more, I echo the Honourable Member, Mr. Tan Wu Meng, that more needs to be done to raise the standing of the nursing profession and further review of remuneration. It also calls for rationality and pragmatism in addressing the foreign nurses who complement our pool. The shortage of nurses is a global one. The UK has launched the health and care worker visa that allows settlement in the UK after 5 years, and applicants can be joined by dependent partners and children. Are we similarly considering something like this? What more is the government doing to attract, train and retain our nurses? Fourth, increasing diversity in the healthcare system. There's a need to broaden the definition of a healthcare worker, where someone who has good interpersonal skills and motivational skills and with technology can play a key role in population health. There's also a scope to increase diversity in leadership, including in cluster leadership, to better reflect the population we serve and the skills and backgrounds required in the new healthcare model. Can the minister share what's being done to recruit, nurture, and deploy people from different backgrounds, especially in leadership roles? Chairman, it's been several years since we embarked on the 3 Beyond strategy. I have a lot of hope that we're now ready to make some bold calls to really unlock it and move forward. There's an urgent need to transform to keep our healthcare costs in check. Our healthcare workforce must be ready. Thank you.